I'd like to introduce Court Robinson, who's an associate professor with a joint appointment both in our department and the Department of International Health. Court?
Thank you. It's a pleasure to be here. Just a bit about myself. I did my degree here a number of years ago in demography, and now, as mentioned, also have an appointment in the Department of International Health where I focus on refugees and migration. I teach a course on migration and health, and my research includes focus on migrant populations, migrant workers, undocumented migrants, trafficked persons, and also those caught in situations of conflict or natural disaster where they're displaced involuntarily, either internally or across international borders.
Court, what would you say to students who are interested in the area of population and health?
Well, I would say that's an important element of understanding health, because if you don't know how a population is composed in terms of age and sex or what its size is, it's very difficult to calculate a rate of any kind. So we know and we learn in demography that populations change in three ways: birth, death, but also migration, which is a very complex thing to measure because it happens over space and time. It's not a single event like a birth or a death. It has many different facets, and what makes it so interesting is also what makes it so challenging, and demographic methods provide us tools to do that measurement better.
And can you give some other examples of how you've used demographic methods in your own work?
Well, one area that I did in my dissertation and continue to do is North Korea. So you can't get into North Korea, not safely. And so we measured people by interviewing migrants who came across the border into China and asked them about their household mortality in years past. And then we're able to use indirect methods to estimate their mortality, their fertility, and other elements of household change. And we use those techniques in other contexts to get to hidden and hard to reach populations in conflict, in disasters, to measure mortality, marriage among children, and other key demographic characteristics that measure vulnerability of these populations in crisis.
Thank you, Court.
Thank you very much.